Experts are urgently calling for increased efforts to promote early initiation of breastfeeding as a crucial intervention as Nigeria grapples with alarming rates of childhood stunting. According to a recent report by the Federal Ministry of Agriculture and Rural Development, a staggering 12 million Nigerian children suffer from stunted growth, making the country the second highest contributor to global stunting rates. The United Nations Children's Fund highlights the severity of the crisis, indicating a national prevalence rate of 32% among children under 5. However, only a small fraction of affected children receive the necessary treatment, prompting urgent calls from experts for immediate action. Nutrition and child health experts, including registered Dietitian-Nutritionist Nwabumma Asouzu from the Alex Ekweme Federal University Teaching Hospital, stressed the critical importance of early breastfeeding initiation within the first 30 minutes of birth. Now, they emphasized that exclusive breastfeeding for the first 6 months, followed by continued breastfeeding until 2 years of age, is paramount in combating stunted growth. To discuss this, I'm joined by consultant pediatrician Dr. Ayodele Renner. Hello, doctor. Thank you so much for joining me.
Hello. Good afternoon, everyone.
Good afternoon. All right, so doctor, how does early breastfeeding help Nigerian children stay healthy and grow properly?
So early breastfeeding, as we know, is a very important intervention when it comes to child survival. It's actually, as a matter of fact, is listed as one of the child survival strategies. And why early breastfeeding or early initiation of breastfeeding is important is that there is a higher success rate of exclusive breastfeeding in the first 6 months of life if breastfeeding is initiated within the first 30 minutes of birth. And this is because when the baby is able to bond with the mother within the first 30 minutes of birth, and breastfeeding can be initiated within that time, the mother is going to produce colostrum, which is the breast milk that is initially produced, that is rich in certain factors and proteins that prevent the child from getting infections. And so if the mother can actually start to breastfeed on time, her success and likelihood of lactating on time and sustaining that lactation is significantly higher.
All right, so now why is exclusive breastfeeding for the first 6 months and continued breastfeeding until 2 years, why is it crucial for Nigerian children's health?
It's particularly important for Nigeria because given the present economic situation, alternatives are not readily affordable, and even where they can be purchased, unfortunately, because of the prevalent lack of education amongst a lot of parents and caregivers, the safety of the water supply and how well these alternatives are constituted is called to question. And so it has been proven time and time again that the best way of preventing recurrent or repeated infections as far as nutrition is concerned in the first 6 months of life is breastfeeding exclusively. And the benefits don't just stop at the first 6 months of life. Actually, children who are exclusively breastfed are protected from diseases like pneumonia, meningitis, and ear infections up until the age of 5 years, especially if the mother can continue breastfeeding up until the child is 2 years. WHO recommends exclusive breastfeeding for the first 6 months and continued breastfeeding for 2 years and beyond. When I say and beyond, of course, the mothers, raise up their arms in alarm and say, who is going to do that? But it actually is something that can be done. And stating it further, the environment, unfortunately, in terms of public sanitation and hygiene, is not really where it ought to be. And so one of the interventions in preventing children from acquiring some infections that are environmentally determined, like diarrheal disease, for instance, due to poor water supply, and then overcrowding can also cause pneumonia, is exclusive breastfeeding. And so if we can prevent these infections, then cost of healthcare is, saved. And in the first 6 months of life, a woman who is exclusively breastfeeding is not going to have to spend money buying those alternatives that we can find on the shelves. And that's some money saved to do other things for the family.
Okay. All right. But then what are the risks of stunted growth among Nigerian children? I really want to also know, the relationship between stunted growth in children and how it affects their ability to fight diseases. Can you explain further?
When we refer to stunting, what we mean is that a child has a length or a height that is significantly reduced for the particular age. So if we expect a child to be a certain height or length for their age and it is less than a certain level, then we say that that child is stunted. And stunting is an indication of chronic malnutrition. This means that the child has not received adequate nutrition for such a long time that their linear growth or their length is significantly affected. Now, one might imagine, well, I mean, it's just the height, so what could be so bad about that? If the height is affected, it most likely means that the child is probably deprived of certain micronutrients like iron, like zinc, like iodine. And these nutrients are very important for cognitive function, learning, mental capacity. And so children who are stunted are less likely to be able to learn and acquire new information and process new information adequately or quickly enough to make it functional in a manner of speaking. The other thing is that when it comes to stunting, because if you look at the top 5 killers of children under 5 in Nigeria, apart from issues of prematurity and newborn issues, we're talking about pneumonia, diarrheal disease, HIV/AIDS, malaria. And when it comes to the ability of the child to fight off infection, the ability of the child's immune system to ward off infection, if a child is stunted, their ability to fight off infection is significantly reduced because they are not likely to have as much protein because all our immune systems actually use a lot of protein to fight off viral or bacterial infections. And malnutrition has been consistently shown to be an exponential multiplier of morbidity and mortality where it occurs in the child with an infection. A child who is well nourished would be more equipped to fight off relatively mild infections, while a child who is stunted is more likely to be incapable of fighting off infections that might otherwise have been relatively unharmful.
All right, so now in your expert's opinion, what measures would you suggest on how Nigerian communities and healthcare providers can work together to ensure more children receive early breastfeeding and adequate nutrition to prevent stunting and also to promote better health outcomes?
Great. I think that's the crux of the matter. And when it comes to determining how to solve this impasse, health education is very important, and I think this is what we exactly are already doing. We have to realize that in Nigeria, early initiation of breastfeeding can be challenging because a majority, and some research has actually quoted up to 70% of births in Nigeria actually don't occur in a hospital setting. They occur at home, in maternity centers, in churches, in religious homes, those sorts of things. And so, and it's a minority of births in Nigeria that are attended by skilled birth attendants who have the knowledge of being able to initiate breastfeeding within the first 30 minutes of birth. So health education to educate mothers and let them know that, okay, first of all, try to give birth in a health facility. And if for one reason or the other you don't, and you are giving birth at a facility that is regulated maybe by the state government, please let them know that even if the worker there does not give the person the opportunity to initiate breastfeeding at 30 minutes, if the mother knows that initiating breastfeeding at 30 minutes is important, then she will request for it. So health education is very important. Bolstering primary health care as well, I think, is critical, such that wherever there's a healthcare facility that take deliveries, they can actually initiate breastfeeding. Letting funding is very important. Training of healthcare workers to make sure that as they go for home visits post-delivery, they educate the mothers on the fact that exclusive breastfeeding is actually very important, is key, and is something that should be practiced. And the fathers as well, of course, have to be involved so that they are aware that they need to support the mothers in every way possible to ensure that the burden of doing the other things in the home is lifted off them so that they can focus squarely on the practice of exclusive breastfeeding.
All right.
I think these are, I mean, some measures that we can actually employ to help to prevent or mitigate the problem of stunting. Of course, the idea of, introducing semi-solids at 6 months is another, entirely different ball game altogether, in which multi-sectoral collaboration has to come in which food security must be improved. The economic lot of the families and of Nigerian families has to improve to make sure that they're able to purchase adequate amounts of nutritious and high-value foods to ensure that even if they do exclusive breastfeeding, when semi-solids are introduced, they don't fall back or they don't, lapse into stunting in the process of introducing semi-solids.
Okay. Well, thank you so much for all that, and also speaking to us, giving your expert opinion on this topic, Dr. Ayodele Renner. We appreciate you for speaking to us on this.
Very many thanks for having me on.